24-bed hospital, children's hospital, first freestanding hospital in Broward County for children. And we have a tremendous amount of different services. We're the first program in Broward County to do heart transplants. So we do have patients that are in the hospital with an artificial heart that sits outside of their body in a pouch. It's called a Berlin heart, and it's cannulated into the veins and arteries of their heart to keep the blood circulating through their body until a heart can be obtained for transplant. To this date, we've done 22 heart transplants, all of them very successful. These patients that are in our hospital can have those artificial hearts outside their body for over a year. Wow. And they stay with us for over a year until it's done. We had one young lady named Daniela, who she was our 21st heart recipient that we did the surgery on. 13-year-old girl, the most vibrant girl you could ever meet. She actually wrote, she was very upset with the Berlin Heart Company because the heart sits here. If she were to walk to go to the classroom, because we have a full-time teacher on staff at the hospital to help children who are in the hospital continue to learn. But whenever she leaves her room, there's a cart that goes with her, because that's the pump that keeps the blood flowing, okay? She was very upset because as a girl, the cart was not pink. She wrote a letter to the company. The company then delivered a pink cart to go with her wherever she wanted to go. So we have some very fun and dynamic things at the hospital. We have the busiest neonatal ICU in Broward County. It has 64 beds. We just expanded to 20 beds. Everything that you're going to hear me say is expansion, because our services and our service lines are growing. The emergency room, I'm a little biased of that. We're expanding 14 additional beds. We're going to be expanding 50% of our volume. We saw 70,000 kids last year in a 29-bed emergency room. That averages over 200 patients a day. Okay, so although they're not the super acute, we can see anything from a hangnail to post-heart transplant, potential rejection symptoms. So our nurses are very skilled at every phase of illness for every patient that we see. The statistics are important to know. The statistics are great. We're expanding out here to Weston because there's a need out west. Okay, so we have medical offices going up, specialty practices going in the medical office building over here near Cleveland Clinic. More specialties than I can think of. I believe there's going to be neurosurgery, endocrinology, neurology may be out there. The the Joe DiMaggio Children's Hospital just hired 2 new neurologists. Okay, 1 new neurosurgeon. They hired an orthopedic, non-surgical physician whose only job is to look at concussions, because that is such a big topic now of all the sports, whether it's soccer, football, anything, any sport. So while growth is great, and to tell you how much we're growing and that sort of business, it's more compelling, and it's probably more interesting for you all to hear the stories. And I'm speaking from from Joe DiMaggio, but the expanse of Joe DiMaggio goes throughout the system. So a perfect example is just last week, excuse me, at our Memorial Urgent Care Center that's on Douglas Road, just south of Pines Boulevard. There was not a patient, but a visitor going to visit a patient who was in the urgent care center. She was 23 weeks pregnant. Like most 23-week pregnant women, they needed to go use the restroom quite frequently. So she went to the restroom, and while she was in the restroom, she delivered the baby at 23 weeks. The baby weighed 500 grams. Now, at Joe DiMaggio Children's Hospital, our ER, our nurses go out to all of our sister facilities. We go to Aventura if needed. We go to Holby Cross. We do all education to all our referring facilities, because we want to make sure when we get that patient's in the best shape they could possibly be. Not only that, we do a ton of community outreach. So about 2 months before this happened, we were out at the urgent care center. Our nurses were going out there to talk about resuscitation, okay? So we get out there, we do our education, everyone's great, it feels good. Some of the staff I actually saw last week, they said, we never thought we would ever use it. In comes the 23-week pregnant lady who delivers the baby at the urgent care center. The nurses at the urgent care center were awesome. They sprung into action. Everything we taught them, they did. They called 911. The patient was transported over to us. They had already communicated with our neonatal ICU. When the patient arrived in the PEDS ER, NICU was there. The mother at the same time was going to the adult ER to go up to labor and delivery to finish that process. Baby is doing fantastic. Most 23-week, 500-gram babies don't make it. The baby still has a breathing tube in, but when you look at all the neurological signs, when you look at everything that child is supposed to be doing, it's meeting and exceeding the expectations of the physicians in the NICU. I actually had a meeting with the neonatal ICU manager yesterday. They're thinking, you know, they say it's going to be a long road, but this is a long road that they're going to finish. They're going to see it to the end, and everything is going to be great for this child. So that kind of gives you, although we're 6 hospitals, we're so integrated. And we had 3 hospitals, essentially, Urgent Care, which is under the umbrella of Memorial Pembroke, Joe DiMaggio Children's Hospital, and Memorial Regional, all working together in concert to bring great care and great outcomes, not only for the mother, but for the 23-week baby that was born. So that's one great story. Another great story is about 6 months ago. You know, we talk, before I get into the story, you know, we talk about trust. And you've seen our campaign throughout, you know, 595 and I-95 about trusting Joe DiMaggio. And, you know, there are services that we have that people need, and there are services that we have that people want, okay? What's the difference? If you need a heart transplant, we're the only game in town. Jackson does not even a third of what we do. The next one, I believe, is up in Gainesville, Shanks. So if you need the heart transplant, Joe DiMaggio is your thing. But if you want the care, anyone can do seizure management, maybe not well, maybe not perfectly, but every hospital can take care of patients with seizures. We had a patient that hadn't even started seeing this yet. They had an appointment with the Joe DiMaggio neurologist, and unfortunately at that time, it was taking 4 months from the time you called to the time you could get in to see a neurologist. They had that appointment set. Father is with his daughter. She starts to have a seizure. What does he do? He doesn't call 911. He knows that if he calls 911, they're not going to come to Joe DiMaggio. Why? Because they live in Boynton Beach. He put his seizing daughter in the car and drove 60 minutes to Joe DiMaggio Children's Hospital for her to be cared for. Not advised. I'll be the first one to say that. However, when you look at that trust, you know, and the firemen over here are like dying, right? But when you look at trust, they're trusting their child to Joe DiMaggio Children's Hospital. So, you know, those are you know, 2 pretty compelling stories, plus Daniela's journey through getting a heart transplant. So I don't want to take up too much